in the Philippines, or dentists here in the Philippines, use metal braces to straighten teeth.
And that's painful, I think.
Yes, yes. Now, they have an alternative, no, and it's cost less.
I understand 10% of what you would spend abroad or here in the Philippines. My God, that makes a lot of people have a chance at having a brighter smile, and more than anything, the self-confidence it generates, right?
Patients before who have braces are those who are class A and B, but now class C and D patient can have their teeth straight without using this metal braces. Now, we have this product called Position Liner. So this Position Liner is a plastic material that can be used by patients who want their teeth straight, and of course, to have their perfect smile.
Well, Dr. Rico came back after 30 years in the U.S. and he hasn't just brought Position Liner, he has also brought back technology that doesn't hurt, doesn't, you know, laser.
Yes. Basically now, Worry Total Med is using cutting-edge technology, which we feel can be very efficient in addressing the dental problem, and very cost-effective at the same time. So with medical missions, with Worry Total Med, we're partnering with everybody, because ultimately, at the end of the day, we want to give 10% of our income to the medical missions to save lives. So this is part of our corporate social responsibility. So every year, we try to do 10 to 20 cleft palate operations free for children. This is our mission, which is to give back to the community and to change lives. And at the same time, this year, we're giving free diagnostics. We have MRI, CT scans, we have medtech facilities, we have echo Dopplers. We're giving it pro bono to some of our indigent services. And that's our philosophy, is ultimately to really give back to the community.
That's so wonderful, because you know, right now the Philippines, I have been with the medical wellness, tourism, and retirement industry for the past 3 years, and the industries and the jobs are related to being a frontliner, to be facing people, you know, whether you're in the front desk or a service crew in a restaurant. The look, the face, the teeth is very, very critical for them to have the self-confidence and the smile that is so very valuable to being at par, if not better, than the other countries that you're tourists to their destinations, no? So can you tell us, Dr. Rico, how beneficial is the plastic Position Liner to the metallic brace that was of the 20th century, I guess, that has been, or up to now, I still see people with metal braces.
Well, the old way is the metal braces.
Okay.
But as far as straightening teeth now, we have a cutting-edge technology. We use, this was invented, and by the way, by a Filipino dean of dentistry.
A dean like me.
A dean like you. And manufactured, produced, researched by a local Filipino dean of dentistry.
Who happens to be the father of Dr. Roman.
Dr. Roman.
From Bulacan, no?
Yeah, Valenzuela.
Oh, where the sweetheart of our president comes from.
Yeah.
The name of this show is Pinoy Matters, and he has chosen to be called Pinoy. So it's just as well that we have a Valenzuelan constituent here in our midst.
So not everybody can wear metal braces, and sometimes
it's
the
painful.
treatment, yes, it's painful, and it takes 8 to 12 months to 16 months for the treatment, whereas our treatment is from 1 month to 3 months.
You're kidding me.
Shorter treatment time. It's much more comfortable to wear, and for people that are, say, movie stars that come in, they can take it off. It's a clear plastic.
So they can do their shows.
They can do their shows, and when they're eating, they can take it off. Whereas with the metal braces, you're stuck with it for 12 to 18 months.
Yes.
And so people that are speaking, that are hosting shows like this, it's much more, it's clear, it's unnoticeable. So we offer them an alternative. It's an alternative treatment. Plus, the number one factor also is the price is 1/10 of the cost of what the price is in the States.
Yeah,
and it's
I was
locally
told,
produced.
ladies and gentlemen, to our viewers, it's only about 20,000, right?
Yes.
And up, depending on how complex
The case.
the
yes.
case
How crooked
is.
it is.
But see, you are giving people much more than just a straight set of dentures or teeth. The self-confidence that comes out, you know, from your children or your own selves, you know, and I understand there's no age limit for ones to have a position liner.
Yes.
Even I can still avail of one.
12 years old and above.
Oh, I'm not
Nobody's
quite
too
12
old to
yet.
have their teeth straight.
Okay, so you can still fix at 60,
Yes,
70,
yes.
the retirees?
Yes, of course.
81, 83, yes.
Really?
Nobody's too old to have their teeth
Straightened
straight.
teeth.
Then
Crooked
we'll have
teeth
a
can be
lot more
straightened out.
beautiful smiles because of your movement.
Yes.
Because of its gentle action, and before braces are painful. Now, because of its flexibility, it's gentle on the teeth.
I see. Well, we should let the students know, because part of the insecurity I know of people who are in grade school, high school, college, and I've seen a lot of beauty queens. Yeah, even our Miss Universe Beth was wearing, you know, correctional braces before she competes next month or next week in Las Vegas, right? And really, I mean, I have been in doing presentation skills training for a long time, and it really would help if even your diction, the clarity with which you speak, and not just the visual beauty aspect, really it's very important for people to have a good set of straight, you said straight?
Yes.
Straight on the oval.
By the way, we are also inviting dentists to call or visit us at Worry Total Med for this product. So we can teach them on how to use this, because
Is it easy to learn on how to install?
It's very easy to use, very gentle in action, and it's clear and practically unnoticeable.
Raul, question, because I used to wear contact lenses. So are these ready to go, or it has to be custom fitted?
It is should be custom fitted.
I see. And how many days from the time they make the mold and it's sent to the
about 3 to 4 days.
It goes back to
Yes,
them. All right. Okay.
Dentists can order it from Worry Total Med.
Well, there will be a lot of future hosts like me with nicer teeth if they're able to. Okay, so why, for the education of our viewers, why is a good set of straight teeth not just for the beautiful visual aspect, but why is it important for health, for someone to have his teeth straightened?
Also, you can you have to have straight teeth for function and for to prevent periodontal disease or gum disease. You should have a straight teeth, because if you have crooked teeth, many of the food or sugars stuck on those crooked teeth. That's why you will have a gum disease.
For hygiene as well. And then, Dr. Rico, you're talking about the bite. Tell our audience about the bite. They might not be aware the importance of having a correct bite.
Yes.
What are the risks of
well, when you have malocclusion, it's like it's
malocclusion. Okay.
So every time you bite, you're putting 4,000 pounds of pressure per square inch, and they say that you do this 1,700 times a day. So it's a cumulative effect. So if your bite is improper, it affects your joints. So later on, you have headaches, migraine headaches.
Without knowing that was the cause.
Without knowing it, and it can also dissolve the joints that you have. So It's a disease that needs to be addressed just like any other type of disease. And we feel that we have a product that's effective to address malocclusion. It's not a cure-all, but it's done on selective cases. And it's also an affordable product. So you don't have to pay exorbitant fees to get treatment for your disease. So basically, our concept is to give it to the massa so they can afford it. Whether you're rich or poor, it should be affordable so that you can correct the problem of malocclusion, of aesthetics, you know, because you want to have a Hollywood smile. Everybody's always aware of their cosmetic smile,
yes,
the way they
dazzling
talk.
Smile.
And if you have crooked teeth or flaring teeth, it affects the way you talk, the way you
Definitely,
the way you
I
eat,
will assure the audience that, you know, when you have teeth, you can articulate better your consonants and your vowels.
Yes.
We're coming to the end of our episode. Doctors, thank you so much.
Thank you.
One of the things that I hope this segment will allow our viewers to have is that it seems that dental care in the Philippines is not as looked after as it should be. You know, I know there are a lot of teeth brushing and toothpaste advertisements, but bringing your children, your family members to a good dentist doesn't seem to be the normal thing to do unless you are covered by a dental health plan. I mean, I know parents who probably don't know that they should be bringing their children regularly for dental care from twice a year, right?
Yeah.
For teeth cleaning also. It's like a car. You bring
For regular
for regular checkup because gum disease and also impacted tooth, cavities and all that. No, and of course, why we entitled our show "Live Alive Today" is because we want you to have the very best appearance so that your self-esteem and self-confidence radiates whenever you meet people, and that is for me very priceless. Certainly worth more than 20,000 plus that it would cost you to have your dentures or your bite corrected. So I'd like to give the last few minutes to our guests. Would you like to say a few words first, Raul?
Yeah, okay.
And say hello to your dad who has innovated, a Filipino innovation. This is so wonderful.
I'd like to greet my dad, who is, I think, watching right now. He's in the laboratory in Valenzuela. And let me tell you this, that now we can reach all those patients, not just class A and B, but also with
CDX.
CMD. Yes. So everybody can use it.
Because there's some people on the 7,100 7 islands that are not in the ABCD category. Dr. Rico, they're flashing a special plan that, as you said, you're trying to make dental care as affordable as possible. Can you please talk about what you have?
Just quickly to follow up on what Dr. Mann said about periodontal gum disease, periodontal problems. Now they found out that periodontal plaque coming from the mouth is associated to heart attacks because it can lodge to your blood vessels. So now it's an accepted fact that it can even lodge into your brain, so you can suffer from a stroke. So it's very important. It's not a small problem. Actually, if you're the one that suffers from the heart attack, it's a huge problem. So take care of your teeth and come and see us, and we will be there to help you, to guide you, to show you how best to take care of your teeth. Again, Wuri Total Med. It's on the corner of Buendia and Batangas, close to Cash and Carry.
Okay. Well, ladies and gentlemen, the Thursday morning has rushed through us again. I'm Deanne Hernandez. I'll be with you again next Thursday. I'd just like to acknowledge our sponsors, Animus, who provided some barongs to our anchor staff, and Michelle Lim of Occasion, who also gave a nice blouse to wear for our anchors. I haven't been able to thank them. So thank you so much for watching. I'm Deanne Hernandez.